We are here with my beautiful patient. She came all the way to have this surgery from maybe years and years, and she's thinking to have rhinoplasty. She trusts me, come here. We did beautiful nose surgery together. We want a little bit drastic change. So this is the before from the front view. We want some definition for the nose. We use rib cartilage for that. And the nose looks more slimmer, more lifted, but not too much. But also from the side view, very important change that I want to show you. We don't hate our side view, but we try to give some definition and some sharpness to teeth. So we use rib cartilage for that. Just still, it's a little bit curvy. We try to maintain that. So I didn't increase the bridge part too much. So with raising the tip, it still gives us some curvy look, and also the tip is lifted but shortened at the same time. So it's really looking very balanced with the remaining part of the nose. Also from this ankle, you can see the change. It's just 5 days after surgery, so we experience so much swelling on the nose. When the swelling goes down, usually the bridge height gets a little bit low. So sometimes my patients are worried about to keep it very high. It doesn't look natural or something, but this is temporary. Weeks later, months later, it's looking still very beautiful and also natural at the same time. And you can see the definition for the tip. When you touch the nose first, it was soft, but the rib cartilage, you feel a little bit stiff. This stiff feel does not remain the same. As an example, like 2 years later, it will feel more softer. But rib cartilage is so strong than our original cartilage. So this feel is the feel that I tell my patients you need to use to it. But when you get older, it's changed. It feels more softer. We need this stretch to prevent excess flaring. When we smile, our smiling muscles works and it causes some flaring. This is something that we cannot do anything, maybe some Botox. When the tip is strong, it doesn't move downward and it keeps that stretch with these techniques. So it looks still harder, still more defined, even patients are smiling. Yes, that's all for now.
Thank you.